Here is another good idea, and it starts with this. When you're battling cancer, every step is difficult. Surgery is oftentimes a very effective treatment, but the recovery process can be long and painful.
News 10's Gabrielle Carroll spoke with a cancer survivor who's turning her own experience into a product that's helping other patients now.
Well, you're about to meet Cindy Dolphin. She's a 4-time cancer survivor who's battled 3 different types of breast cancer. Successful surgeries mean Cindy's been in remission for the past 3 years, but she said the recovery process was pretty uncomfortable because of medical drains. Those are the tubes under the skin that help reduce swelling that are then attached to hospital gowns with safety pins. Cindy says that's just not the best solution.
You need to empty those drains 3 or 4 times during a day, and they're often stuck under you. The tubing will get in the way, and it can actually tear out the sutures. It's a very uncomfortable thing.
Looking for a better solution, Cindy invented the Keeley medical drain carrier.
And then the drains are placed. This is a drain.
Essentially, it's a mesh apron that you can tie around your body that will hold the drains and tubes.
The way that I developed this is that it was created so that a patient can go and shower, come out, let it dry in just a few minutes. They don't even need to take it off the entire time that they're recovering from the surgery.
In the 6 months the Keeley carriers have been available, Cindy's gotten them into 2 Dignity Health hospitals and UC Davis Medical Center, where Cindy was treated 3 years ago. Nurse manager Gary Kurtz says the carriers have been a hit with both nurses and patients.
It's a very simple, low-cost, effective way to manage the drains. I think it's a great idea. Patient's personal experience, saw a problem, developed a solution, and brought it back to us with the intent of improving other patients' experience.
Cindy's currently looking for investors to grow her business, but she says making money off her invention is not her primary goal.
It is just a unique sorority when it comes to breast cancer of women that are there to help each other, and it's really kind of a beautiful thing. You feel that once you survive it, you've got to go back, and you want to go back and help women that are also going through it.
And Cindy's not just trying to help cancer patients. Those pattern carriers you saw just a second ago are actually made by women living in poverty in Kenya and Tanzania. So Cindy's giving them work as well.
And only someone who's been through it could think of an idea like that doctors and nurses have endorsed.
Exactly. What she described is you have these great surgeons, but then they're not really involved in that post-operative care.
Yeah.
So they don't know how these medical drains, what a burden they are on the patient. So it takes a patient's eye to really recognize that.
Oh, I bet you she finds that grant money or the investor money and maybe some grant money just to get it started because it's doing the right thing.
And what a better person, to tell that story.
Exactly.
Right, helping women in 2 areas of the world. All right, thank you very much. Well, new